We are not even looking at removing the mandate. It's not even something that's on the agenda. So that is not a good plan at all. It's not on the agenda at all. The immediate priority for the unvaccinated is to protect them from infection, and that means to keep unvaccinated people away from crowded environments, because you'll remember that these hospitality locations have had a lot of their restrictions lifted, so vaccinated people can live their lives normally, and it's not fair on the vaccinated to ask them to make sacrifices for the very small number of people who have not become vaccinated.
So, as the Minister has told us, we are seeing increasing numbers of cases across the state, and this is exactly what we expected, and this is what we expect to continue to happen. What I want to say, though, is we've had 12 of the cases mentioned by the Minister were linked to interstate travel, all fully vaccinated, all fully vaccinated, all fully vaccinated. And I can tell you that we are identifying additional cases of Omicron hour by hour, so there'll be more cases tomorrow. We want people to start wearing masks indoors, in public transport. On some positive note, and it's only a small positive note, I have spoken to every doctor that's looked after the patients with the Omicron virus. All of these have been vaccinated. And for what it's worth, all of these patients are well. They're not sick at all. They're not sick at all. 42 may seem like a relatively small number, but you will recall this is double the number we saw just 48 hours ago. I have had an opportunity to speak to most of the doctors who've been looking after the patients with the diagnosis of COVID-19 in the last 24 hours, and I can say that all of the patients, with the exception of one, have minimal symptoms or no symptoms. The one patient who is moderately unwell and breathless in one of our teaching hospitals was unvaccinated. At this stage, we have no one in intensive care in our hospitals. You will be aware that previously we have been admitting all patients with COVID-19 to hospitals in Queensland, mostly for infection control purposes. We are moving away from that model, and we are clearing beds to allow capacity in the coming weeks, should we require it. I can also tell you that information in the last 24 hours suggests that the Omicron strain is becoming dominant in Queensland, with 21 out of the 25 last tested viruses being found to be the Omicron strain. This is happening very rapidly. If this trend continues, it will be dominant within days. The 42 cases that we've seen have been spread now again across the state, right down the east coast of Australia. The latest location, the latest city where we're seeing COVID-19 is Mount Isa. So it's not just the coastal cities that are affected, now it's the inland cities. So all Queenslanders must consider themselves potentially exposed, or that it is likely that most Queenslanders will be potentially exposed to this virus in the coming weeks, and our behaviour needs to reflect that. Obviously, we all need to get vaccinated. For the few of us that haven't received our first dose, please go off and get that first dose. But for those who are 5 months after receiving their second dose, it's a good idea now to get a booster. Now, 89.53% of the Queensland population is double-dose vaccinated, and 84.22% single-dose vaccinated. So we would expect the 90% single-dose target to be reached sometime in the middle of this coming week.
We are not even looking at removing the mandate. It's not even something that's on the agenda. So that is not a good plan at all. It's not on the agenda at all.